Oh, good God. That feels so good. I've been wanting to pop my back like that for years. I have constantly bending and twisting and never been able to pop it like that. It feels a lot better.
Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now I know you've been experiencing pain your entire life. Mm-hmm. You've been on, as you told me, pain medications, and you went from one thing to another, and you're not wanting to be dependent on that anymore, correct? Right. So if you could kind of tell everybody just what you've been on and like what medical doctors had you on and your different paths of prescriptions that you've been through.
Okay. I have spina bifida and scoliosis, so I have major back pain. I've been on Norcos, Lortabs, all kinds of different pain. I have morphine and naproxen.
And so now you're trying to get off, but every time you've tried to get off something, you'd almost start having, or not almost, but you would start having withdrawals. Right. Because you're on a medication for so long. Right. So your body is physically becoming dependent to these medications, and you're living every day, obviously you're in pain, and it's like you're dependent on popping just different pills, and then obviously when you're taking like a narcos or something very strong, I'm going to imagine you're probably not yourself 100%.
It was like I've been on them for so many years, it was literally like taking Tylenol. I mean, it wouldn't affect me at all.
Gotcha.
Because my body was so
just
used to it. It wasn't even helping with the pain anymore.
Okay. Okay. So already, as you told me, being diagnosed with scoliosis, and then with having the spina bifida. Now, granted, the spina bifida that you have, I know there are multiple different types and different variations of spina bifida. There are some where you have the spinal cord that's actually being pulled out, and the meninges pulled out. Now, that's not what you have. It is a closed.
It's closed, and the bone that I'm missing is like the size of your thumbnail. It's very small.
Okay. Yeah, so it's just that spinous process is what is missing with hers. But what we are going to do today, because I know that the issues that you're having, I mean, you ranged from headaches and migraines, not as much migraines, you're telling me, as frequent.
Yeah, they're not.
The headaches you're still having, though.
Yes, almost daily.
Okay, headaches daily, neck pain, into the shoulders, upper back pain, middle back pain, lower back pain, hip pain, sciatic pain.
All on the right side.
All on the right side. Okay. And when you were pregnant, you were telling me the sciatic pain was even worse. Mm-hmm.
I couldn't even walk. I had to be like in a chair with my leg propped up.
Okay. So as you guys can tell, she's been through everything.
Yeah.
If there's any amount of pain that one could experience, you've experienced. Okay. So what I'm going to do, I'm going to have you stand up for me first. I want you to look all the way up at the ceiling for me. Any pain when doing that?
No.
Okay. Look all the way down to the floor. Any pain with that?
No, I can feel it stretching, but it's not painful.
Okay, so on that right side?
Yeah.
Okay. And then if you were to bring one ear to either shoulder, any pains with that?
No, I just feel stretching.
Okay. And then if you were to rotate and look over shoulder, any issues there?
Just right there.
More on the right side? Okay. Actually, I'll have you bend forward at the waist for me. Any pain with that?
No.
Okay, come on up and bend back like that. Any issues there?
Right. Oh, right there.
Right there? Okay. And then if you're to come to one side, any issues with that? And to the other?
Right here.
Okay, all on that right side. And then if you're to rotate, and then the other side, any issues with that? No? Okay. I'm going to have you take a seat. So we're going to do some orthopedic tests. I'm going to have you sit up nice and straight, and I'm going to push down on the top of your head here. Any pain with that? Okay.
Just pressure.
Just pressure. Turn your head to the side. Any pain with that?
In the neck.
Okay. Did it stay in the neck, or did you notice it travel into the arms?
And it was right here, the base of my skull down, and it stopped about right here.
Okay. And we're going to turn to this side here. Any pain with that?
Nope.
Okay, good. Now I am going to distract. Let me know if there is a increase, decrease, or no change.
Right there, it feels like you were pulling.
Felt
like a bubble was
okay.
there.
Felt like a bubble was
It felt
there.
like a bubble was there, it was about to pop, but then it didn't.
Okay. Okay. What I'm gonna have you do, I want you to lay on your back for me first. Just because I know you have that right-sided.
I have a very high pain tolerance.
I could imagine. Alright, so we're gonna raise this leg up. Any issues with this side?
No.
Okay. Bend that foot, any pain there? Or we're gonna cross like this. Any pain in the low back or hips? Okay, good. Alright, I'm gonna have you flip over, lay face down for me. Okay, so actually we're gonna bring your hands, I'll show you. Right, and go down just a little bit. Yep, right there. Alright, so we are going to go ahead and, as we start with every patient, we're going to scan the entire body. We're going to check that symmetry from the right side to the left side. Now, granted, I know you've told me that you do have a scoliosis, so I will definitely be able to feel that when palpating down your spine. So let's go ahead and get started. Now, anything that I do, if I push in and you do notice some pain, let me, feel free, let me know. Okay. I just kind of want to know exactly what's going on, where there is pain. So we start in that cervical spine here. Any pain with me pushing in? No. Good. And we're coming through that upper back, that thoracic spine, and I'm actually starting to feel that curve here, so I can definitely know exactly what you're talking about with the scoliosis. And we're coming down the back here, so we went from that cervical spine, going through the thoracic, went in that upper back, middle back. How's that feeling? Good. Okay. Feeling good. And then now we're coming into that low back, into the lumbar spine. Any pain through here? No. Okay. Any pain over that right SI joint? No. Any pain directly over the sacrum? A little bit. A little bit? Okay. And then any pain over that left SI joint? No. Okay, good. So we're going to come down here and we're going to check the leg length out. So when we look at the legs, we can tell that we've got a right short quite a bit here. Okay, and then we're going to scan up the body. So the hips are looking good, but I am definitely noticing a little bit, it's like two ways of how the thoracic spine, we're getting like a raised area in through here, and then also up here. So granted, that's going to be with that scoliosis, but what we're going to do, we're going to first, I just want to relax the areas. We're going to use the massage device, relax, and then we're going to start that adjustment. There we go. Alright, so like I start every adjustment, we're going to come right up here at that cervical thoracic joint here. And we're going to start right here with that T1 on the left. Good. I'm going to drop down to T2 on the right here. There we go. I know you felt how that just opens up. And removes all that pressure off the nerves to allow the body to function and to heal.
Like I feel a really warm sensation.
Good, good. So she's feeling a really warm sensation, so she's already feeling pressure being removed, and the signals are now starting to actually fire freely, as they probably haven't been able to for some time. Okay, I want you to take a deep breath in and exhale out for me. Good. We're going to drop down just a little bit. One more time, deep breath in and let it out for me. Good. Okay. So just with doing that upper thoracic, lower cervical adjustment and the mid back, I mean, you guys can clearly see it's still a little bit short, but a lot better than already what it was. Okay, so now what I'm going to come down to, we're going to check out the sacrum. Now I know this is actually on the S1 tubercle is actually where you have that spina bifida, so you may have, this may be a tender area, obviously for one thing, but I'm going to stabilize on the sacrum. I want you to raise that right leg up as high as you can for me. Not from there, hold on, relax. I want you to raise your leg like that. So relax, relax. Let me stabilize first. Now raise that leg up for me. Any pain, tenderness, tightness with that?
Tight.
Tightness, okay. Relax that side and raise the left side for me. How does the left side compare to the right side?
The right side's a lot harder.
Right side's harder, okay. So what I'm gonna have you do, I'm gonna have you cross the right foot over the left foot for me. Good. And the table is actually gonna come up from below you. Okay, so we're going to do that P to A, posterior to anterior drop, and what we're going to do a counterclockwise torque to bring that sacrum back to midline here. And one more. Good. Uncross, and just this knee for me. Good. Let's do one more. There we go. And relax. Okay, so I'm going to stabilize right here again. Raise that right side up for me. Do you notice the difference?
Yeah, a little bit.
Easier to raise up?
Yep.
Good. And relax. So now we're going to come back and we're going to recheck that leg length. So now, actually, if you guys notice, the right is actually a lot longer than the left. So there was quite a bit of change here. So what that's telling me now is that there's going to be lumbar involvement. So what I'm going to have you do, I'm going to have you lay on your side and face me this way. I'm going to bend this top leg. Yep. Just like that. Good. I'm just going to, perfect. Rotate you over like that. Relax just like that. Good. Perfect. I'm going to have you flip to the other side for me. Same thing here, so we're going to bend that top leg. Yep, just like that. There we go. Flat on your back for me. I'm going to bring this down just a little bit. There we go. Okay. So now we're going to be doing a leg pull. With the leg pull, you may feel that release in the ankle, and then the knee going all the way up to that hip. So just relax, let me have that leg. Good. And we're going to check the other side here. Good. Alright, I'm going to have you stand up for me. I'll have you stand and face the front here. Come up just a little bit. Good. Bring your arms out by your side. Okay, I want you to put your hands up and over mine. Yep, just like that. So I'm going to lean you back onto me, squeeze your elbows together. There we go. Feel how that released? Good. I'm going to have you take a seat right here, facing the wall that way. Yep. Okay. I'm going to have you give yourself a big hug. With this one, I'm going to have you take a deep breath in and exhale out. Good. Already cleared out, which is a good thing. So I'm going to have you just slide down just a little bit. Perfect. So now we're going to do the Y-strap adjustment. And with this Y-strap, this is where you're going to get that decompression. You'll feel this all the way up top, going all the way down. So this is going to help with a lot of pressure. And I know you've been experiencing a ton your entire life. If you can pull the bottom of your hair through for me. Okay. So now you've never had this technique done before, correct?
No.
Okay. So this is that Y-strap technique. You're going to feel your entire spine just decompress here, okay?
Oh, good God. That feels so good.
And relax. How did that feel?
Like I've been wanting to do that for years.
Good. I'm gonna have you come on up. Alrighty. If you were to tell anybody just how that Y strap was, just what it felt like, what you experienced, to anybody at home who's never been able to actually have that adjustment, how would you describe it to them?
Like I just said, I've been wanting to pop my back like that for years. I have constantly bending and twisting and never been able to pop it like that. It feels a lot better.
Feels a lot better?
Yes.
If you look up, look down, go through the range, is it easier than when you first came in?
Yeah.
Do you notice the difference?
Yeah.
Good. That's why that's exactly why I have patients that come in to see me, because even in one adjustment, you notice that relief. Now, I know you told me when you were younger, you were going to a chiropractor 3 times a week for how long?
Just for a quick adjustment.
Okay.
You use the little thing that they pop your spine with.
Use the activator?
Yeah.
The click, 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 click.
Mm-hmm.
Okay. And from just say that to this,
Makes
was
a
this
difference.
completely different?
Yes.
So you can definitely notice a difference between the adjustment from this and, yeah, okay, good. Yeah, this is why, I get a lot of results and relief with my patients. I mean, that's why I get people always coming in to see me and wanting to get that adjustment done. Because I have so many people, especially with that Y strap, that even how you said you've been needing that and wanting that for years, and now you're able to experience that. So what I'm going to do, I'm just going to follow up with you a little bit, just kind of let me know how things are going. Okay. We got a ton of movement, a lot of pressure taken off those nerves. Let me know pain levels, text me, email me, and just kind of follow up. Okay. Sound good?
Yeah.
Perfect. Yes. All right, if anyone is looking to schedule an appointment, just go right to the website, drjosephcipriano.com, send a message, and I'd love to get you in here. Have a good one, everybody.